Dipanjan Sujit Roy. He is the team lead strengthening CHPC in urban areas, PWC-ADB, to this webinar, sir. Dr. Dipanjan.
Thank you very much. Good morning.
We welcome you on behalf of both the institutions. And we thank you, sir, for taking our time. And it is so great to see your dedication that you are there always, sir, and working for this great cause, sir. We thank you on bottom of our hearts. We also welcome Dr. Jayanti Dutta, who will be just joining us shortly, and ma'am is a consultant and clinical psychologist. She'll be just joining us shortly. So I just, to give you a brief introduction about both the organizations is, Vishwa Yuvak Kendra is one of the pioneering youth organizations started in India in the year 1961, and it has been focusing on the youth and also the grassroots level NGOs around the country. And it is also focused.
Good morning, ma'am. कैसी हैं आप? जी, कितने बजे आप ज्वाइन? 11:30 कर लीजिएगा अगर आप.
Yeah, Rajat, please go ahead, Rajat. Yeah.
Rajat, please unmute. Kindly unmute yourself, Rajat.
Sure. So as I was saying, so we have this very important topic, and before I just start with that, I just wanted to give you a small introduction about what Vishwa Yuvak Kendra is. It is an institution of of national importance, which is working on the youth, and also with the grassroots level NGOs, and it was started in the year 1961, and its main focus is towards the group, is towards the youth, is towards the grassroots level NGOs, and also working with the youth on the international level as well. So when we are working across the country as well in India, especially working in India across the country, with thousands and thousands and lakhs of youth, around the country, and we are organizing regular webinars, trainings, capacity building trainings in various states in Delhi at our campus as well. So this is basically our program based detail, and just to give you a little more information, Vishwa Yuvak Kendra was started by Shri Morarji Desai, who was the former Prime Minister of India, Srimati Indira Gandhi, Shri Naval Tata, Shri Ravindra Verma, Shri Vijay Shah, and Shri Ramakrishna Bajaj were the founders of our of this institution. So and our present chairman, Mr. Rajat Kumar Narayan, and our managing trustee, Shri Shishir Bajaj, are present on present board, and we thank them. That without their support, this webinar is being completely impossible. So also just to give you a small introduction about Sons Arts and Science Colleges, it has been an institution which was started in the year 2009 and 10, which is a new institution. And it is growing so rapidly. And it is basically, this institution is started to cater to the students of the socially and economically backward first generation students of Tirunamalai, and along with the districts of Vellore, Villupuram, and Dharmapuri. And they are having courses in various, in arts, in science, and in various such fields. So they are a very prestigious college, and I would like to thank Dr. G. Sashi Kumar for giving us this opportunity on behalf of Vishwa Yuvak Kendra. We thank you, and we also thank Dr. V.K. Punnavati as well to be part of this webinar. And also, I cannot leave one person behind, Mr. Arun Gunushekaran, who is to share with the team. He's been the director, very young, dynamic director of the college, who's always there to support us. We thank you, sir, and also the chairman, Mr. V.S. Gunushekaran as well. We thank you all. And now, finally, I would, welcome to Dr. G. Shashi Kumar, Principal, Sons Arts and Science College, to give a background and this short info about the college. So, over to you, sir.
Good morning. Good morning, everyone. Thank you very much for joining us today's webinar entitled COVID-19 Vaccination Drive. role of youth and civil society organization for social awareness and mass mobilization. On this pleasant moment, it's my immense pleasure to welcome our respected chairman, vice chairman, secretary, treasurer, and a beloved director of our college. At this juncture, I would like to welcome the dynamic resource persons, Dr. Dipanjan Sujit Roy and Dr. Jayanti Dutta, and the vibrant coordinators from Vishwa Yuvak Kendra, Mrs. Apurva Gautam, and Rajat Thomas. And I extend my warm welcome to the faculty members of our college, students, and students from neighboring institution. Good morning to all in this August occasion. Today, we are all aware of the COVID-19. The severe pandemic has led to a dramatic loss of human life across the globe and present an extraordinary challenge to the public health, food system, and the working culture. The coronavirus COVID-19 pandemic is a major global health disaster and the greatest challenge we have faced since World War II. Though it emerged in Asia at the end of the year 2019, the virus has spread to every continent except Antarctica. Now we have reached the tragic milestone of more than 2 million deaths. Every day, the people are losing their jobs and their income with no way of knowing when normality will return. The International Labour Organization estimates that 400 million jobs could be lost for the past 1 year due to this pandemic. The World Bank projects that around 800 million people will not be able to meet their basic needs also. Though there is no remedy for this pandemic situation across the globe, we are in the need of hour to prevent the spreading of infection. In this regard, the government of India have issued safety measures like maintaining social distance, wearing of mask, frequent hand washing with soap, use of alcohol-based sanitizer, and the installation of Arogya Setu app. Based on the guidance from the National Expert Group of Vaccine Administration of COVID-19, the COVID-19 vaccine has introduced in a paced manner with the first phase focusing on healthcare workers, frontline workers, and population at a higher risk. The prioritization of group will depend upon the disease incidence and the prevailing pandemic situation. India launched one of the world's largest coronavirus vaccination drives in the month of January 2021, aimed at stemming the widespread of infections across a nation of more than 1.3 billion people. So we should set an example before the world. The world is looking at us with hope. As a responsible youth of our nation, we should aware of the vaccination and educate the people around us and let them to be aware of it. Thank you. Thank you very much.
Thank you so much, sir. Thank you so much. And we once again, we thank you, sir. And almost 500 students are joining us through Zoom. So it is really glad to see, sir. And once again, so now I would now like to, start with the most important part of our webinar, why we are here for. So we are here to listen to our resource persons who are carrying innumerable amounts of years of experience in this field, and I welcome. Yeah, sure, sir.
Rajat, if there will be the over 500 people, then people will be, your students will be not able to join, but they can join on YouTube or Facebook. Manjunath ji, on which we have given the stream live.
Sir, it's on YouTube, sir.
Facebook, YouTube. So Rajat, please make an announcement, clear-cut announcement for the students. If students will be not able to join after 500 on this network, that is the Zoom network, they can join through the VYK YouTube. And Manjunath ji just sharing in the chat box. Yeah, please Rajat, please go ahead. This was important.
Rajat,
that's why.
Yeah.
Rajat, just would like to add, Jayanti Dutta ma'am has also joined.
Sure. Yeah, I know that.
She has been promoted
Sure.
as a panelist as well. Yes.
Sure. So I would just like to inform, as Uday sir, our chief controller, was sharing with us, that those people who are not able to join us through the Zoom they can join in through with our YouTube link. So you may kindly find that in the chat box. Good morning, Dr. Jayanti Datta ma'am. Good morning, ma'am. We are not. If you can unmute your video, ma'am. Ma'am, we are not able to hear you.
Unmute your audio, ma'am.
Manjunath, if you can just kindly request ma'am to unmute her audio.
The permission is already given to her. It's up to ma'am. Ma'am, please click on the unmute option over there on your screen.
Okay. I think ma'am will just
move ahead. Dr. Dipanjan sir will share the thought, and in meanwhile, madam will be able to unmute herself.
Yeah, I think so.
Just do the needful.
Yeah. So first of all, I welcome you, ma'am. Ma'am, I think your audio is unmuted.
Unmuted. Have you?
Yeah.
Are you able to hear me?
Yes, ma'am.
Okay.
Good morning, ma'am. Ma'am, on behalf of Vishwa Yuvak Kendra and the Sons Arts and Science College, Tamil Nadu, ma'am, we welcome you to this webinar, ma'am, and thank you for taking out so much of time for us, ma'am. We thank you once again, ma'am.
Thank you. Thank you very much.
Sure. Now we go towards our main part of the webinar. I was saying, now we have, if I can request Mr. Manjunath to share the profile of Dr. Dipanjan on the screen, it will be great for the students to see that. Yes, thank you so much, Mr. Manjunath. And so we have our very first resource person for the day, Dr. Dipanjan Sujit Roy. He is a senior public health professional and academician, implementation expert with almost 30 years of experience, and he has worked in WHO, US CDC, UNAIDS, UNICEF, and various other international NGOs, as well as the Government of India. He was awarded with the Global Health Achievement India Award by the US CDC for his contributions towards developing and adopting global public health policies. He has more than 20 plus years of international experience spanning over 3 continents, Asia, Africa, and Europe. So this is just a very small and a very, I must say, very minute, introduction of Sir, because he has got various experience and various, he's worked with various organizations. So this is just a small gist, if you can always find him on LinkedIn or various other platforms, you may find complete details of him. So, sir, we welcome you, sir. And we thank you, sir, for once again being part of this webinar. And sir, you will be speaking on the importance of COVID vaccination and vaccination process, do's and don'ts in vaccination process, pre and post precautions and consequences, and few other points, sir. So over to you, sir. So if you can unmute yourself, sir. Thank you so much.
Thank you, all of you. And once again, a very good morning to all of you. And my co-panelist, Dr. Jayanti Dutta, I think a warm
Thank
welcome
you.
to you. And it will
Thank
be
you.
a pleasure to share the dais with you.
Thank you.
And taking this opportunity, let me take this opportunity again to thank Vishwa Yuvak Kendra and the other is Kanwani Sun Arts and Science College, right? I've got it right, I suppose. Uh, Apologies and pardon for if I couldn't get it right. It's Sun College, right? That's what I have seen. Sun Arts and Science College in Tirumalapillai. Okay, great. So without further ado and others, I would take you through some of the core concepts of coronavirus and its vaccination. Most of you have already heard about coronavirus, right? It's been mentioned, and also I think Dr. Shashi Kumar did put up everything very nicely, giving a context to the whole thing. Plus, I'm sure all the students who have also joined us here, a warm welcome to all of you. You would have also got many messages. Mostly the WhatsApp University does update us and give us a lot of information, whether right or wrong, but at least gives us the information. So, coronavirus is there. COVID-19 had brought in unprecedented amount of things for the country, and not only for the country, for the whole world, and so forth. So let's try and see some of the basic facts. I'll not go to too much details because that will take up too much time. The topic of today, what we are looking at is looking at the vaccination, what are the precautions and what are the myths and misconceptions and some basic data, how we are doing across globally. As very rightly pointed out, in fact, Rajat was mentioning this wonderfully, that India is now taken as a friend for all the neighboring countries, not only neighboring countries, even far countries like in Africa, Latin America, like Brazil, Far East Asian countries like Timor-Leste and others, Vanuatu's Western Pacific region, etc., which most of us wouldn't have heard the name. And India has sent vaccines to those countries free of cost, helping out the vaccination and trying to combat the COVID-19 pandemic across the globe. So without further ado, let me start sharing my screen and you can have a look. Can I get still showing disabled? I don't know. Apurva or Rajat, if you could kindly allow me to share the screen, or I can send the slide sets because it's easier.
Yes, sir. I would request Mr. Manjunath to kindly allow Dipanjan sir for sharing the screen.
Yeah, okay, Mukta, give me a moment.
Happens is since many people are watching this, it's a large audience gathering across, and it becomes difficult to follow certain times, even if we speak slowly. Sometimes you can read better. That's also the case, and how we do it. Still,
No, the permission is already given. Sir, you can share your file now.
host disabled participant screen sharing. No, it's still not coming.
Give me a moment.
Its recording permission was given, but not the sharing of the screen, I suppose. Well, technologies do take some time. Don't worry, it is normal. I have in the last 1 year or so, we've had so many Zoom conferencing. We've learned Zoom. In fact, a good thing is we've had to learn so many new things. Anyway, without till the time we are sharing, let me start off with some of the context. And I did see a question which was I answered. How long have coronaviruses? It's Manigandan Ravi who has typed this particular one. So let me start with a little brief history of coronavirus. See, coronaviruses are not new. Number one, it's been there in ages. It's been there since quite a few number of centuries. We don't know when, but it must have been there. Viruses are old hats. They've survived. they are on the borderline of living and non-living. Is it still come? No, not yet. Should I send you the files then? Would that be a better option? If we are not able to, I'll just...
Yeah, you just send it, sir. We have given the permission from our side, but somehow it's not working from your end. So if you could just send it, so we will do it shortly, sir.
Okay. I think, whom should I send it to? Ajit ji or?
Yeah, yes.
Yes, sir.
Okay, okay. So let me just quickly... Or anybody, if you can give me your email, I'm typing it, so you can always speak. If you tell me, I can send it to you directly without...
Yeah, that's fine, sir. It's Manjunath. No. Yeah, you can share it to either Rajat, anybody one we can collect it.
Or I'm available, Manjunath. Ask sir to send to me.
Yeah, please send it to Ajit Kumar Rai, sir.
Okay. Even Manjunath also I have typed. So anything Manjunath.
So good, sir. Good.
That's great. Manjunath@vykonline.org. That's okay, sir.
Okay, Manjunath@vyk.
Online.org.
Online. Here this way, I suppose.
Yeah,
These are technological challenges sent. You should be able to receive it within a short time, and if you're able to project it, it will help out. Anyway, let me start off with, let me see if somehow miracle has happened. No, not yet. What normally you have to do is, I don't know, anyway, you will be receiving it, so I'm not, let me just go to the participants view. See, you have to give me a host permission primarily, a co-host or something, you know, that's the only...
Yeah, I can promote you, so I can promote.
If you promote me there, it's also the same concept. Just click on my name and you can promote me as a host. Co-host. Yeah, I think now it should be fine. Yeah. So done? Yep.
Yes.
Now it's
sir.
working, sir.
Yes.
Right. Okay. Can you see the full screen now? Let me start off. Is it visible to all of you?
Yes.
The full
we
screen.
all can see. Yeah,
okay.
Full
Wonderful.
screen.
Wonderful. So let me quickly, run you through with this, the novel coronavirus. And the word corona, as it is, that's on the king's head, as they say, those kind of spikes. So it has a spikes all over. So that's how the name corona had come in. So fair enough. This is the second slide, which shows you the current worldwide situation. This is updated as of yesterday. So you can see the number of cases which are available. It's 100 million cases across the globe since this WHO started tracking this pandemic. So 111 million cases across the globe with more than 2.4 million deaths. You can say 2.5 million deaths. That's not a small amount. And these are all attributable. So if somebody says that the COVID is really not doing its job, people are not dying. Yes, it's been very kind virus. I'll tell you, it's very kind virus because the case fatalities has not been high. If we had a case fatality of 20, or maybe I would say if the case fatality would have been very high, say for 5 or 6, which you are looking at, that means 5% or 6%, I'm talking at, or 20%, that means 1/5 are dying. Then you would have seen how the helter-skelter happens. I have seen this with my own eyes when we were combating the H5N1, which is avian flu. Avian flu has a case fatality rate of 76%. So in Cambodia, when things were happening, people surrounded the village, and even if one case was trying to come out from that village, the armed forces were given shoot at sight orders and kill that individual. So it's better to kill one individual as compared to a million dying. So, this kind of panic sets in with everything. So that's a very big problem. Fortunately, this virus is not that thing, and you can see the case fatality is fairly low. It's around roughly 1% to 2% to 3%. India is much, much lower. In fact, much lower than this. The case fatality has been higher in the developed countries, possibly due to the climatic things, as well as the situation there and their more or less the control over the communicable disease. See, in India and developing countries, we haven't had control over the communicable disease like tuberculosis, influenza, whatever you say, the diseases which are easily communicated. But in developed countries, because of good water and sanitation and hygiene issues, they have been able to control the communicable diseases. So suddenly when something happens which you are not at all immunized to, you start getting more and more problems at certain levels. Your panic reaction sets in and then everything happens. That's possibly one of the reasons why we had a higher death rates in developed country as compared to the developing world. Coming to the next one, which is let's look at the situation in India. We've had approximately 11 million cases, which is really large. So we're looking at large thing, and about 156,000 deaths. So that's one place, with 11 million cases and 156,000 deaths. That's where I think India has really done extraordinarily well. I would say that we have been able to take care of the situation much better than most of the other countries. What is the reason? There's no meta-analysis or any evidence available for that, but one of the major factors is we preempted this thing that was coming. We took certain decisions which was very hard hitting for the country, but well, it was hard hitting, but it did save lives. So that's important, because if this, instead of if it was just 10%, think about a 1 million deaths. If we had a million deaths, by this time you would have had a literally a civil war in India. It wouldn't have been nice, because we don't have that much of backup resources, and situation is not that. If people would have come to the streets, it would have been a disaster, and so on and so forth. So many things have to be taken into consideration when you're looking at a public health scenario. So the death rates have been fairly low. That has been very nice, and that's been probably a proactive measures taken by the government of India, and I would say the people of India, who have also adhered to certain situations, and so on and so forth. Now coming to straight away to COVID vaccine. I'll not go to the details of what a coronavirus is, what is a group, and all that stuff. That is, of course, any questions which are there, I can always share with you, and we can always have that discussions otherwise too. But coming down to what is making more news today, or being the buzz things, COVID-19 vaccine. It looks like it's become a little lifesaver for us. We've started opening the doors. We've been much better off to go across elsewhere. We can move out, and you do see the markets opening up, not because of anything else, but at least the faith that yes, we have been able to control certain things. So that's an excellent thing. And for the first time, may I add, that the global community of medical professionals and other healthcare and public health professionals came together to develop the vaccine. There was nothing like yours and mine or something of that nature. Everybody realized that we have to put things together. It's humanity versus something else. So when it becomes humanity versus something else, then everybody does come together. So extraordinary efforts. That's the thing I should put on records by the global community to develop the COVID-19 vaccines. Just look at the time frame. The trial started somewhere in April 2020, and we had a vaccine by December 2020. The number of months you can just count and see, it's less than a 9 months period which we have been able to get everything, thanks to computers, thanks to everything. But more importantly, this vaccine is safe. It is being given to people and they are getting protection. So it's excellent with this 9 months period, whereas a normal vaccine takes roughly, the minimum period is 5 years before we can send it to the market, if we go by the normal means. And just for records, you can always put in that influenza vaccine took about 20 years before it saw the market. So if you're looking at a virus which is similar, if you're looking at a virus which is contextual, you'll always find that this is also an important one, where we had this is the first time when the global community came together, which means whenever humanity is threatened, we do come together. So it's a good thing, but unfortunately it requires a threat to bind us together rather than a love which binds us together. So let's come directly to COVID-19 vaccine. And this is the data which is given on the website of ICMR. So I have had to put it of January 28th, not of February 22nd, of February 23rd, because it's not been updated since then. We have these currently available. Nothing has changed since then. We have two vaccines which are currently being rolled out. One is the Covishield, you would have heard the name, and Covaxin, which is an indigenously produced vaccine. Now you see there are certain types. So the first one is the vaccine, which is the name which has been put up. The second one is the type which is there, and the status what is rolled out. So first and second, Covishield and Covaxin have been rolled out. Great. So there's no problem of that context, and we can look at that. Yes, this Covishield is the major one which is being rolled out, primarily because it has already completed the trials and all. Covaxin is an indigenously developed one, and conditional phase 3 clearance was given on 16th of January. So we've started the vaccination as of 16th of January with the healthcare workers in the initial stage. Then it will be above 50 years with comorbidities, and then you'll roll it out to more and more folks in these. By the time we'll also be having some of the other ones like Zydus Cadilus vaccine, which you talk about is Zycovid, which is there, or Sputnik 5, which is Dr. Reddy's with the your Russian vaccine, which is also good, and biological ease novel COVID vaccine, which is a protein subunit. So this is just for people who are interested in microbiology and others. They would be seeing what is a replicating virus vaccine. Some of them, this is an inactivated virus, so it's a dead virus. Can be given to most of the folks, like even possibly to pregnant women and all. But currently, WHO or the government of India and ICMR do not recommend it to be given to pregnant women and children below 18 years of age. So that's about the vaccines which are available. Let's go further. Uh, Globally, we have 63 candidate vaccines in the pipeline, phase 2 and phase 3 trials. 7 candidate vaccines have either been rolled out or in the process of being rolled out. The first one which we knew was Pfizer vaccine, which came out in United States, and then the Moderna came out. Then we had this Covishield and so on and so forth. There are 7 vaccines available. Prior to that, there are 2 unconfirmed reports of vaccines which are available in China, but somehow the data and all that have not been shared. So it looks like either it didn't really meet the global standards, so it was not really put up in that manner. So that's the reason why WHO did not put up this list of 9 vaccines which have been really rolled out. So 7 vaccines have been put up, and it's been monitored directly through the Covaxin, which is available, the portal of WHO, which is fast track, and every country has fast tracked the context. Now, having understood some of these, how did we, the first question that you may have at many times is, and I have seen that also in lots of this WhatsApp, this vaccine is not safe. You know why? Because it was developed such hurriedly that nothing was really put in. A normal vaccine takes 20 years and you have fast tracked it to 9 months. So you can very well imagine what will be the quality of the vaccine. So if I take the vaccine, there are more chances I'll be dead rather than living. That was the kind of belief most people had. And of course, please understand, rumors take hold of you much faster than real evidence or truth. So our job is to make sure that the rumors are rightly dispensed with the correct evidence which we can put forward into it. See, today the world is progressed hugely from 1970s, 1980s, 1990s, 2000, and so on and so forth. Okay, we've got reverse engineering, which are genetic engineering, which is available. We have computer simulations, which can really build up certain things in a matter of seconds as compared to matter of years, which we had to do if it was done manually. So please understand, today when you are able to do millions of calculations of various kind by just using a computer software or certain things, this was unthinkable maybe 20 years or maybe 30 years before than today. One more thing I want to highlight here is during my childhood days, and I'm sure those who are around my age group, we used to see in the papers that today would be a rainy day, and we used to laugh and said, oh no, the prediction has been that it's going to be a rainy day. We are 100% sure it's going to be a sunny day because they're always wrong. So our predictions for weather maybe 30 years from today, before today, used to be, partially correct, maybe 5, 10, 20% correct. But today, when you see that there is going to be a storm, it's going to be something, it's going to come up in this, more often than not, it is correct. What has made the difference? Did you ever introspect and understand what has made the difference? The answer is technology. We're able to do multivariate analysis in a much better way to give you better accurate predictions of what is going to be the situation. Weather is the most complex thing to predict. Vaccines are hardly anything as compared to a weather prediction. So we use the same tech to do a reverse genetic engineering. So what could be done in maybe 90 years, I can really do it in 9 days. So thanks to the kind of reverse genetic engineering, simulation softwares, and everything which are available. So antigenicity in humans, we have recreated a virtual human body with all kinds of things, and that's where we start putting in. So just to give you a context that yes, the vaccine which has been developed and is being rolled out is completely safe, as safe as the best vaccine available else in the world for any other disease. So this is thanks to the technological advancement and not due to anything. So we don't believe in everything you hear, and kind of myths and misconceptions which come up. So just wanted to make this a major highlight when the COVID vaccine in 19 vaccines which have been put in. So taking that same clue, I would jump into myths and misconceptions for COVID-19 vaccine. This is a list of all the questions we have received in ICMR website and WHO. I've just made small headings so that we could speak on it to give you a more contextual information and so on and so forth. Some of these you are already aware. Some of them may appear stupid, but nothing, no question is stupid, I would say, because it's ultimately, if it is my life which I am going to put online, I better know even the most stupidest thing in the world. So let's start with the first one is, one may get COVID-19 from a vaccine, so better not to take. There has been lots of resistance even among the healthcare workers. Some of the healthcare workers, people who are supposedly educated lot and know things and so on and so forth, they also start believing, no, 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 we don't know what they're doing. And these guys, it's all being controlled by the pharmaceutical mafia and so on and so forth. So you never know what they, and we are being treated as guinea pigs. So if I take the vaccine, I'm as good as dead. Okay. I may die, I may not die from COVID-19, but I will definitely die from something else. So it cannot, it's not practically possible. So there was this huge amount of misinformation campaign done in many countries when the first vaccines came out, that if you take the COVID-19 vaccine, which is a live vaccine, an mRNA related vaccine, messenger RNA, DNA vaccine, which is available, so it's going to really cause COVID-19. Even if you haven't got it, it's going to cause COVID-19. So better not to take. Completely false. It's got no basis, nothing. And just amount, some rumor mongers must have done it. Even if they did it for the fun, it did catch up. So it was an important one to give that evidence that even in the developed country, people refused to take the vaccines. Even they knew that it was fully safe and all, but they said, you never know. Why should I take a chance? Okay, let somebody else take the leap of faith, not me. So first one, completely wrong. The vaccine is new, so will have many side effects. I've already explained. The reverse genetic engineering with the computer simulation and everything else has really caused that this vaccine is perhaps much safer than some of the existing vaccines we give to our children. This vaccine has got the least side effects, the least amount of things, because we've already done the simulation. The amount of money and the energy and the effort and the technical input which has gone into developing these vaccines by across the globe, everybody across the globe, has been phenomenal. So have some faith in the humans. Not everything has to be done by God. We are also capable of fighting the war with nature or any disease equally, and we have to fight it together. Nobody else will fight it for us. So that's the kind of thing which we say, that the vaccine is new, but yes, it is completely safe for humans to use it. No problems at all. Third major myths and misconception which came is the vaccine is not required, as many of us have developed immunity to COVID-19. I have probably been exposed to COVID. Obviously, I would have, because I'm going to the office. I never had to stop. I never could stop going to my place of work, even during the lockdown period, because of so many reasons. So obviously, I would have got infected, but I never got COVID-19 positivity. But of course, maybe a subclinical infection or something must have happened. So I've already got the immunity. Why should I take a COVID-19 vaccine? It's not required for me to take. Yes, maybe true, may not be true, but definitely not true, because the acquired immunity which we are getting is not as good as the vaccine induced immunity. Now you may ask, oh, why is it so? Because in the vaccine, you are using the actual protein. It is the component which is going to introduce the antibodies in you. Whereas in the virus, this virus has got very good masking effect. It has certain things that it's not a very killer, highly kill, I would say virulent virus. Virulent is the word which we use when it kills more people. The case fatality is higher. Okay. Now this virus is not very virulent. So it is like very subtle. It does normally doesn't do much damage. So the body is also not much bothered. Okay, theek hai, aa gaya hai, let it be there. It's come and we can take care of it. It's nothing great. After a few days, will become all right. Majority of people will get well on their own. So the body also doesn't produce that level of your antibodies. But whereas the vaccine is much more concentrated and the body is forced to produce more level of antibodies, which have been seen to be much longer acting. Normally, which we say as a difference between the vaccine immunity is around 6 months period plus, whereas the immunity offered by direct your getting the disease is up to 3 months. Mark my words, up to 3 months. It could be 1 month, it could be 6 weeks, or it could be a maximum of 120 days. Not even, sorry, 90 days, not 120 days, but 90 days. So you are looking at something which is not that simple. So a vaccine induced immunity is supposedly better as of whatever the limited data which we have now. So vaccine is not required is definitely not true. We in anyone who has got even past infection, not the current infection. In a current infection, we will not like to give, because it does have no use. If you already got COVID right now and I give you a vaccine, it's not going to make any difference, and there would be more misconceptions going out in the community as compared to somebody else. So that is the reason why the vaccine is not supposed to be given to anybody who is suffering from active COVID, but anybody else can be given, no problems at all, who is eligible to be given. Fourth one is we are being taken as guinea pigs and safety measures have been flouted. Oh yes, that's what we thought, this 9 months of developing the vaccine. So the first few people who are going to get it are all guinea pigs. Why should I become one? Definitely not the case. It has already been tried out, tested, and met the world standards of your safety and bioefficacy and everything else. Only then it has been put. Completely wrong. We are not taken as guinea pigs, but we'll probably be the pioneers to showcase for more things. And this is the first time when such a global collaboration took place to develop a vaccine. And it's given us great hope for future for any such disease which comes up, where vaccine preventable component will be there. We would be able to develop a vaccine even faster. So it's excellent news, not at all correct that we are going to be guinea pigs and so on and so forth. Next, the COVID-19 vaccine should not be taken by pregnant women and children below 10 years. Absolutely correct. The efficacy has not yet been taken up. So this is not a myths and misconception. Current says that we do not have the safety data, so better not to give. Let it not be given. In India, we have managed no pregnant women, and not 10 years, but 18 years. We are only going to give it above 18 years of age, just to be on the safer, much more safer side as compared to this. So this is correct in this manner. The health staff is not trained, so will not be able to address the side effects of COVID-19 vaccine. This, I think, I have heard plenty from the folks. Even the healthcare workers were saying, I'll take the vaccine. Nobody knows how to give a vaccine, at least COVID-19 vaccine. My simple question is, how is this vaccine different from maybe a DPT or a measles vaccine or something? Because most of the vaccines have similar side effects. What are the side effects? There will be something on your, wherever you take, you will have a little pain, you may get a little bit of fever because of the antibody development, and so on and so forth. And the serious side effects could be anything, which is 1 in 1 billion. If you're that unlucky, you may walk on the road and get hit by a truck or something, or even sitting on the home, your fan may fall on your head and you may die if you're that unlucky. 1 in a 1 billion, as they say. The 1 in a 1 billion, somebody may die because of some anaphylactic reaction where we couldn't give hydrocortisone or certain things. Okay, so that's unfortunate. That's the kind of risk we take. If one person in India, that is out of 1.3 billion population, is going to die because of vaccine, I cannot allow the other folks not to take the vaccine. So that is the kind of thing. Health staff is completely trained, number one. So there's absolutely no iota of truth in this. So we'll be able to take the side effect because it is no different than the current side effects available for other vaccines. In fact, it is much lower in intensity as well as frequency. Intensity is the severity of the side effects, as well as the frequency is the level of side effects which happens. So we speak about, if I just give you a comparison with another vaccine, which is influenza vaccine. Influenza vaccine has serious side effects. Which have serious side effects, which we talk about in the context of, see, even your kidney failure to others, which is 1 in 10 million. And here in a COVID vaccine, 1 in 1 billion. So it is definitely much, 10 times as safer as compared to an influenza vaccine, which people have been taking for the last 30 years. So we can even see a vaccine which has been taken for such a long period of time also has got side effects and so on and so forth. Measles vaccine has got various effects. We know that children, usually in Tamil Nadu, we had these deaths in 2015 and 16 with about 20 people, 20 children being affected with staphylococcus infection. That's nothing to do with the vaccine, but it's how vaccination was given. A little bit of infection which happens because measles virus is a live virus, so it is given to the children. Some amount of infections took place because of staphylococcus, and it just increases and causes death. So that was also the case. So we can take care of any vaccines of that nature. So this is completely a false statement. The other one, which is not so much in India, but in the globe, we had this. And once we get the Zy-COVID vaccine with the messenger RNA ones, it may again surface here as well. Is one takes the COVID-19 vaccine, their genetic code may be changed. I was asked a question in once when I was attempting in one of the neighboring countries, that will I become a toad in a frog from human once I take a COVID vaccine? If we could really do that, that's called shape shifting. I would have probably be the love to be in that boat, because I can then use my magic. Just say a magic, okay, you become a toad, you become a giraffe, you become a goat, and you become like this, as you see in those mythological films. No, yeah, they do it. I hope we could have done that, but unfortunately that is absolutely not true. So make sure that these are the kind of things, and just know the safe. This is absolutely safe. No genetic code can be altered. In fact, nothing can alter your genetic code. It's not that simple. If we could do it, we would become superhumans long time back. Okay. So I'm sure some of you might have seen the movie Boys from Brazil, where erstwhile Hitler wanted to make some, superhumans by trying to alter some genetic codes by introducing something. Failed miserably because it is definitely not possible. It may take us 500 more years to do the altering of the genetic code. When we can, definitely we'll become shapeshifters or something of that nature. Okay. The other ones which are there is, if one takes a COVID-19 vaccine, there is no need for physical distancing, masks and gathering. This is one thing which is causing a lot of concern among all of us. I take the first vaccine and then develop certain things, and then I start feeling, oh, now I'm superhuman. This thing cannot touch me. Your COVID is not in a position to touch me at all, so I'm completely safe from a COVID related issues and all that. So what should I do is leave back masks, leave everything. Please understand, taking the vaccine doesn't produce antibodies in a day. It takes roughly about 3 weeks before the antibodies show something, and with the second dose of the vaccine being taken at 28 days, which is normally the case. 2 dose vaccines for both of them, Covaxin or the Covishield, we have to take two. And we say that by 45th day onwards, you may get appreciable response. So just remember, you may get appreciable response from 45th day. So just taking a vaccine doesn't make me a superhuman, and I stop using masks, I stop using your sanitizers and everything, and start jumping the gun and making a physical or social distancing is totally gone for a six, and so on and so forth. Go for a mass gathering and so on and so forth. As you are aware that we are again seeing an upsurge of the COVID cases in India after a relative lull because of the new strains which are continuously going to come in. That is bound to happen in any places. So one of the good thing is the COVID-19 vaccine has incorporated the proteins from a multiple strains, and we would be enhancing the strain response whenever we get it. So it is going to be more tailor made for the kind of infections we are going to get. So vaccine is that way much better off option as compared to getting the infection again and again. So that's about the vaccine. No need for physical gathering and all. That's not true. One needs to follow all the protocols till the time you really have appreciable immunity. In fact, I would suggest that it should be continued so that you are always safer, not only from COVID, but also from many respiratory illnesses. Then the major worry among even the healthcare professionals have been that there may be long-term side effects of COVID-19 vaccine. Yes, there is a possibility of having a COVID-19 vaccine, long-term side effects, but the side effects are not going to be more than what we are going to get. And fact is, the vaccine doesn't have an effect beyond 6 months or antibody effects at the most maybe 1 year. So it is unlikely that we are going to have any levels of your COVID-19 related long-term side effects. For example, kidney damage or diabetes or certain things. Absolutely none. So this definitely is not going to hold good for this. And the data will suggest this in the shorter period of time to come. The other one is fertility of women may be affected due to COVID-19 vaccine. Absolutely no iota of truth in this at all. It's completely false statement. Is if we could really take up the fertility, and this is I've seen it again and again. Whenever a new vaccine is introduced anywhere in the world, the first thing everybody gets worried is the fertility will be taken care of, because inherently, I think all of us in the country, especially where we have more population, is worried about the fact that the government is going to somehow put in family planning measures through vaccines or through hook or by crook, in this, because otherwise, democratically in a country, you really cannot control the population. Otherwise, everybody else gets after you. So that's probably the reason why this myths and misconception has really come up. Completely false. Nothing is out of truth here. And this is the other one. If I've already got COVID-19, I don't need a vaccine. I had COVID-19 in, say, January. In February, somebody came to give me the vaccine. I said, why should I take it? I've already got COVID-19. Now I'm the most safest person available. And I've also donated my plasma to many of the others to get well. So it's definitely not a good thing. I don't need the vaccine. The answer is no. This gives you a longer lasting protection as compared to originally acquired, as I explained to you earlier. So definitely not true. Even if you had COVID-19 you earlier and you are declared cured from it, or overcome that particular disease, you need to take the vaccine. It will bolster your immunity to a much better extent. So that's about the context I wanted to take care. So it's definitely needed, but you do not take COVID-19 when you're having a vaccine, when you are having an active disease. So that point is very clear. If I have an active disease, if I've been diagnosed with COVID-19 right now, I should not be taking the vaccine because it is of no use. This is the vaccination status as of February 21st in India. You can see we have been able to really larger number of people. So total number of people vaccinated is close to 10 million, and the second dose, that is people who have taken, is close to about 100,000 or 1 lakh, as they say. It's approximately one person. We'll slowly get this up to more or less we should be having. So I just wanted to say, and who are fully vaccinated, the definition is taking 2 doses 28 days apart. Okay, so that is the current guidelines as given by ICMR. That is what we are doing in this the COVID-19 vaccination status and everything else. So having understood this and having said how the government has really put forward and helped us take care of the situation, and this is not only in India, it's been everywhere because everyone is fighting to it. What is our role? Now coming to something, the role of youth in all this. What is the role which we can really play? So let's have a look. What is the role you can play? And I'm very enthralled to see such young people, and we can see almost near 500 participants from various colleges and others who are there, and you are the youth of the country, and you would make a difference, specifically helping us, the government, as well as the other organizations, to help out in this. So let us understand what is the kind of role you can play. Of course, the most important role is to be the source of knowledge. And what kind of knowledge? Not, uh, deranged knowledge, but a correct knowledge for COVID-19 and COVID-19 vaccine in your community. You should be able to uh, forcefully say that, yes, this is what is correct. There is an evidence available to it. Look at this place. Look at this place. These are the things which are available. These are the things which are, context. So that is the most important thing, because myths and misconceptions grow faster in a darker community. We say that whenever a community is hidden from all kinds of information sources, then there is always rumor monging which happens. If you are pushed to one corner, you will be more rumor monging. That should not be the case. You must take care, and this is more important in the rural areas as compared to the urban areas, because the paucity of knowledge and paucity of information penetrating to them, then you must volunteer. If there is any government programs available, please volunteer, because you will make a difference. You will make a difference for all of us. You will make a difference for yourself, for your community, for the country, for the globe. So, it's a larger role you are playing at different levels. You should be able to organize. If you are part of a youth club or you're part of a large college thing, or there's a college, there are certain dramatic clubs, there are certain other clubs which are available in colleges, literature society, or you have scientific societies, whatever it could be, any kind of groups which is subgroups of your college and all. Please try to organize and look at what COVID-19, how to address the measures, what are the kind of things you would be able to do, because ultimately COVID-19 has uh, affected not only the lifestyle and everything, but also the social infrastructure as well as the financial infrastructure of the community and the country. So that is important for us to take into measure. Then lead by example in your community. Yes, you must be the source of knowledge. People will really appreciate that you, if you are able to provide the kind of correct knowledge, the kind of correct things, the enthusiasm and the evidence. Remember, science progresses by evidence-based approach. It does not progress by just by speaking certain words anywhere. You'll see the slide sets which I've used. They all have a reference. If I just go back, you'll see the references which have been put up. So if you're looking at even myths and misconceptions and others, there is always going to be certain references which have been put up, in certain places. For example, the number of cases which we are giving, or you are putting up certain things, which is some reputed websites, not from phishing websites which are available at different times. So follow that kind of scientific basis, develop the science in you, develop the evidence-based approach and the true knowledge approach in this. So that's all what I had to take up. I think is it within time, or Rajat, did I exceed the
No,
time?
sir. I think you have taken your right amount of time and put your presentation in a very articulate way, sir. And it was on time, sir.
Thank you
And
very much.
the information that you shared is a timeless information, sir. So that is the most important key, sir, because this information that we say that you were already mentioning about Google University and WhatsApp University, we don't know what is the legitimacy of those information, but here we have you, who has, gone through the in and outs, and are very clear with the information and actual facts, and, this presentation, it shared so much. It gave us such a great insight, on with the COVID vaccination drive, the different vaccines, that how people are thinking in such a short span of time, something can be created, but it is being created because it is not just a country which is just taking part in it. It's the whole world which is putting effort into it, and everybody wants to survive, so there is the sharing of information which is there in the medical field. So I think that has also helped, and also because of our hard work as well, because we have been able to do that in such a short span of time. And as you shared with the very important myths as and misconceptions that people normally have in Indian society, people that that we have natural immunity, like हमको अभी तक कोरोना नहीं अभी like अभी तक हमको कोरोना नहीं हुआ है तो it won't happen to us, so I think we have that idea that we are fit, and we are all good, and we take Ayurveda, and so and so. But it is not like that. And so gave us the fact check, and what are the important points in that, and what are the do's and don'ts, the consequences, So thank you, sir, once again on behalf of Vishwa Yuvak Kendra and Sons Arts and Science College, Tamil Nadu. We thank you, sir, for sharing such a clear presentation with the students. And I hope these students, around 500 students who are here, this webinar will be will be of no use if this information is not disseminated to the family members in your houses, to the children, to the women, to old people, because this is very important because it is a life, it is a matter concerning our life, not just our lives but lives around us. So please do not keep this information just to yourself. Spread it as much as you can. You're young people with strong voices. You don't get tired, so you can always do that. And it will be really happy to see this initiative being taken along by the students of the college as well, because all we say, every movement should be a youth-oriented movement, and the youth should take, charge of this, make some ambassadors there, we can also support you in this, and, spread this message even there, in the local level, more in the community level where it's needed, So once again, thanking you, sir, once again, for taking our time. And now I welcome our second speaker for the day. We have Dr. Jayanti Dutta. Ma'am, we are very grateful to have you, ma'am.
Thank you. Thank you so much.
Yeah, ma'am. So, ma'am, just to give our participants just a brief about ma'am. I think her bio is as well very lengthy bio, because she has vast years of experience. But
that does not really matter when you speak to the youth.
Yes.
Yes.
Yes, but ma'am, surely, because ma'am has more than 30 years of experience in the academic field, and she spent more than 30 years in Lady Irwin College, and that itself speaks, ma'am, how great of a person you are, that you have spent your lives with the students, and nurturing them, and creating some sort of new processes, positivity in them. So, ma'am, just to give all our participants a brief about Manjunath, if the slide is not visible, if you can put ma'am.
Yeah, I'm sharing it again, Rajat.
Yeah. Yeah. It is gone. I think, Manjunath, if you can just. Yeah, it's there. So Dr. Jayanti Dutta is a clinical psychologist and an academician of global repute with numerous years of experience in the sector. She has worked with Lady Irwin College, like I said, for more than 30 years. She's worked with the NIC, the CBI, the CBI Academy, the CFTT, the IIPA, the Delhi Judicial Council, Bureau of Police Research and Development. She is also the recipient of the fellowship from Ministry of Health as well as the Ministry of Education. And she is the winner of the coveted State Award for the best work in the field of child welfare, Government of India. And she is known across the globe for issues related to safety of women and children. So, ma'am, once again, we welcome you, ma'am. And the stage is all yours, ma'am. Thank you so much, ma'am.
Thank you so much.
Once again,
Thank you
on behalf
so much.
of both of us, welcome you.
I'm indeed grateful to the Vishwa Yuvak Kendra and Ajitji. We've been, working together for quite some time, and this is indeed a very sensitive issue to pick up. And I think my earlier speaker, Dr. Roy, has really done it so well. His deliberation almost covered all the items. But since I'm a psychologist, I probably would have a different angle. But as you talk about COVID-19, I don't know how many of you could have heard All India Radio FM station. They picked up my jingle. Now, this is one virus where you cannot say, okay, done. If I'm suffering, I'm suffering. The dangerous part of this virus is it doesn't affect you alone. it takes along rest of the people with whom you come in contact with. This is one virus where the individual himself is not affected alone, but he is or she is responsible for all those people who are associated with him or her. Now, there are certain pertinent things which has to be talked about. So I would start sharing my screen. If you see this, this is the chief symptoms are fever, cough, and the shortness of breath. What I'm finding mostly in the metropole of Delhi, I'm also visiting faculty to a couple of nursing institutions. I find that, they take it very lightly. Okay, you have cough, you have slight fever, does not matter. Take this concoction and you will be all right. And when it reaches a point where you cannot keep the patient anymore in the house, then they rush out. Otherwise, they just don't pay any attention. Luckily now, the awareness has increased. Things are not that bad now. But still, the precautions which should be taken has been neglected mostly. Now, what happens? The Ministry of Health and Family Welfare has already issued these kind of things. We have been successfully able to implement the utilization of the mask. Okay, the mask is something which even the children are using. Sanitization, yes, everybody is talking about. The problem comes when it is maintaining the distance. See, basically we Indians, we don't feel that we are greeting somebody really cordially, or you are greeted cordially, unless and until you shake hands, you hug. And I have seen my own granddaughter would say, why, grandma, it's so bad. I can't touch you. I can't hug you. Now, this kind of thing, the minute you found that, yes, there is an opportunity, probably this is going down, maybe it's not that bad. So you will say, Hone do jo, whatever happens, let it happen later, but I cannot stop myself. I will come closer to you. Let us see. I've seen this among the college going students also. I don't care what happens to me, but I must hug you. Now, this is something which is very dangerous, and this has to be the message has to be conveyed. Then you have these other things also, this promotion aspect is something which is, of course, after this thing, there are a lot many hassles happening about the prompt testing also. Testing facility, someone is there, sometime it is not there. People are not even sure where to rush. And, there has been a real confusion about who all would be responsible for getting the tests done, who has to be trusted. Now, this has to be kind of taken care of. Now, isolation is another thing. Now, there is some clarity about the testing part now, at least in Delhi, but I don't know about other places. And there are designated spots where the testing can be done. There are certain private labs also where they have been accredited for testing. Now, about the isolation part, I have seen that in the communities where you find that the person is affected, isolation becomes a very difficult thing, because these are nuclear families. So one person is affected, obviously the crowding is also there. So this is where, again, one has to concentrate and take care. Now, the other thing is promotion. How can you promote about the informations? I find it's easier if you speak the local language. You already have some kind of a rapport. Rapport formation is very, very important. Wherever you go for public communication, you want to spread the message, you must have that friendly approach. And then promotion, I think, you can use the media, you can use the loudspeakers. Now in Delhi, we were doing it, And at a regular interval, there will be people, you know, with the audio system fitted, with the messages being spread out to the colleges, to the schools, to the neighborhood, to the marketplaces. I think this is very, very important. And language, of course, has to be paid importance too. Influencers. Who are the people? Anybody and everybody cannot influence the public opinion. You must find your crucial figures from the community, from the organizations. When, if they start speaking, then people will say, all right, the credibility of the persona is such that yes, you should listen to him or her. That also has to be tapped. Now the rationale, why? Dr. Roy also highlighted, why should I really go for this kind of preventive measures? I'm not affected, but as I said initially, this is one virus which is so dangerous. It is straight away attacking your immune system. And, you know, this is something which is not only affecting you, but the people who love you, people who are associated with you. If you love your people around, you have to be more responsible. And that is why you have to convince that, yes, these are the preventive measures one should take. And let me tell you, I think those who are listening to me, I have over the decades of academic research at postgraduate level, at doctoral level, even for drug addiction at Delhi University, we have had the PhD thesis submitted. We found peer group has a definite say. If your friends approve of something, you will go ahead with it. If your father has bought you a gift, even if it is expensive, I have seen the youth, really, the youngster doesn't appreciate that unless and until the friends appreciate, yes, this is good. If friends appreciate your hairstyle, you go ahead with it. If your mother doesn't like, does not matter. Your father sort of, you know, is anti your hairstyle, you would say, no, my friends are doing it. So the peer group is the support of the youngsters. If you can have 4, 5, or maybe a group of your friends, and you can go and give some message, ultimately this gets accepted. So our expectations of the youth is, you know, you can influence, you can communicate, you can demonstrate, and of course, you can use the pressure, the psychosocial pressure, which is very, very pertinent. You influence your people at home, you influence your family members, and you spread out to the neighborhood. Now the vaccination. The vaccination part has been very widely covered by my earlier speaker and very thoroughly covered. But still, I feel that, you know, certain things are to be taken care of when you talk about vaccinations. Like, what are the important component of the vaccination? And you have to take care and spread the message that these are the misconceptions. So I think vaccination, whenever you talk about people, the psyche is such, you know, a needle will be pierced in my body. Why should I go for it? So the resistance start from the very initiation of the thought of vaccination. Oh my God, a needle. I'm not talking about the children. Children, of course, you scare them. Oh, you go to the doctor, he'll prick a needle and he will give you an injection. You know, very often I've heard parents threatening the child that if you are not behaving, we'll take you to the doctor and he'll pierce you with an injection. Now, this concept, which has been embedded in the socialization itself, is very difficult to outgrow that. Every time you go to a doctor or you talk about the vaccination, you have that resistance, you know. So you have to break that resistance. You have to tell them that this is not only for you, but for the people who are associated with you. And very often it works. It works. because there is a kind of a thing, does not matter if I die, what will happen? I've heard people saying that in the hospitals also. But when you tell them that the people whom you love, they will be affected, it works. And I think if the youth takes it on, it would certainly convey a significant message. Now, role of CSOs, civil social organizations in COVID-19, what these organizations can do. During lockdown, you have seen that so many nations, so many states where they had removed the lockdown, again, they are planning to go down to the lockdown, adopt the lockdown. Risk communication and support to people, for essential services. So what the organizations can do, they can provide the informations, preventive and control measures, including social distancing during the phases of COVID outbreak. This is becoming a problem. As I said in my earlier this thing also, see, two things you can manage, but social distancing is something which is refuted everywhere. It's a challenge. And here you would probably need real marathon support of the youth who can have the volunteers to monitor that these gatherings, marketplaces, religious places, or wherever there is a gathering, even the colleges, you have to see that there is a automatic spontaneous tendency to gather together and forget about the social distancing. I'm not blaming the public, I'm not blaming the people, but it's inherent in our nature. So you have to be the volunteer there, and then you have to address the myths and misconceptions, support information for home quarantine. Now, home quarantine here, again, the community can be of big help for psychosocial support. There was something which was happening initially when there was home quarantine. The patient who was suffering from COVID-19, because of the fear, the people will stay away, and the patient had a tough time getting the routine mundane things for his own life also, like food, milk, all these things. In certain communities, they took over the responsibility. Here again, the youth can help, social organizations can help, that you see that if you have a patient in particular area or in particular family, you provide the things, you make it convenient for them to get the things. The patient cannot go out, people who are in quarantine cannot go out. So what has been happening in certain places is they have been providing the things to the doorstep, and then when they get all right, they made the payment and all that. I think this is where lot of youngsters were helping. In certain areas, I've seen that the youth gathered together and they enjoyed. When we assign a responsibility and our youngsters believe in it, they do a marvelous job. And I'm sure if those who are listening to me, if they are convinced, yes, you are a very, very important part of our community, they will take on this responsibility and they can certainly take care. Now, the problem starts, there are certain families, who will say, no, we don't have anybody suffering, we don't believe in it, so we will not go. Now, this is where you have to target, you have to be a little more careful and see how cleverly can you drag these families out. And, this could be the regular immunization sessions or the health center which you have nearby. You coordinate with them and you target these kind of families, and you can have the informants who can come and tell you that this is what had happened. Now, where youth can help, I've been trying to say that youth has a major role. Youth can definitely help in facilitating the healthcare workers. And, the screen has to be seen. Then you have the personal hygiene. 1 minute. Okay. And personal hygiene, drive personal COVID appropriate behavior hygiene. COVID appropriate behavior has to be communicated with your sanitizer, and then of course with the maintenance of distance and mask. And there has been certain areas where masks has been distributed, and then you have to see that the when you go to the hospital, or when the patient is going to the hospital, the doctors also have the PPE and whatever the things are required, because one person, you know, this is one virus where you cannot risk the patient traveling also very often. So you have to facilitate that also. And there youth can help. Then rural community outreach. Now there are certain areas where, you know, the mass media is not so easily available. Now this is where I'm sure youth organizations can take it on their own and visit these kind of areas and sit with the rural community and spread this message to them. Then drive for social inclusion also. When the patient is suffering, there were certain myths. This was so dangerous, but luckily it is been contained that if the person is suffering from COVID, stay away from that house. There was social isolation totally. And there has been cases where the patient has committed, after recovery, committed suicide. Why? Because the community thought this is the house where you had the patient, so you boycott. So social boycotting is not something which should be tolerated, because the person has had COVID. So here again, the youth can go ahead and you know, take care of this and enhance the social inclusion. COVID appropriate behavior and care in isolation. When the person is in isolation, or the family is in isolation, or there is a catchment area where the people are saying there are so many cases of COVID-19, so there cannot be some kind of an interaction. There, the youth can make sure that there is a community support, focus on the vulnerable children, women, and elderly. And of course, as I was saying, that ensure that the daily mandatory supplies, rations, key foodstuffs are delivered to the family. Now, sometimes even they need the drugs and the vaccines and the medicines. That also, again, the youth can, of course, help and provide that. Urban outreach. Now, urban outreach is again something where, you know, you have a lot of facilities. You can go to the clubs, you can go to the community centers, you can go to the marketplaces, and of course, you can spread this message. And you know, the interesting thing here in certain colleges, what they did, they designed a particular outfit and they made the youngsters wear that. And then, you know, in group, they would go to the community and spread the message about the COVID appropriate behavior. And, you know, by virtue of the fact that they were wearing such colorful dresses, they were together and, you know, they were smart youngsters. And when they spoke about something, people did take the message and it worked out brilliantly. Now, mass mobilizations, open communication channels. Sometimes, you know, what happens is you address somebody and then it dies out there. After you are gone, matter finishes. So here what you can do is, like in community nursing, community mental health, we do talk about the designate, isolate out particular individuals, you know, who will give you the information whether this has been adhered to or not. Now, when you have somebody from the community who is coming out and helping you with your drive, it becomes easier because that person is seen as my own, from my community. So this person is my own. And if this person is in touch with the outsiders who are visiting and spreading the communications, they synergize and the drive is on for the mass mobilization. Now, myths is something which has been talked about so much in detail. Now here, what I'm going to talk about is not only the ones which are listed, but when I interacted with the group, I often go for public addresses. And here, since the places I go because of media and all, very often already people know me. So they come out with certain kind of their doubts, and the major this thing which they have is impotency, autism. And the people who are not married, they say, oh my God, if I go with this, and as rightly it was pointed out, that you have no proof where this vaccine is really going to work or not. Vaccination leads to high probability of allergic reaction and it will kill the recipient. Now what happens is, there is a tendency for the people to believe in rumors, and rumor mob, it has its own psyche. You don't need a proof. If somebody you have talked to and the person is giving you a wrong message, and there is a tendency to spread that message without taking on the sense of responsibility is lacking. Those who spread this kind of messages, you will find these kind of people almost in all the societies, in all the communities, and you have to counter. This is where the youth can come in a great force. If you find there is a rumor mongering happening, and this happens, I'm sorry, but it starts with the ladies most. One housewife tells something she heard, oh, that happened there, and there is no verification, and it goes on. And when this is also a psychological thing, when you spread some negative thing from one mouth to the other person, the second person will add on something, and by the time it reaches the fourth person, it is already a huge amount. Vaccination can induce COVID-19 in recipients. You don't have COVID symptoms. Why should I go for the vaccination? I don't need it. I'm a healthy person. I'm taking this concoction every day, the turmeric and long, clove and cinnamon, all that, and tulsi. I think in India, most of the households have the tulsi. If you're taking that, you won't get COVID-19. That's not true. That's not true. And people do say that, if I unnecessarily go for this, I will probably get the COVID-19. Vaccination can change the recipient's cellular DNA. This is another nonsense, another myth which is rampant. History of infection negates the need of vaccination. Infection is not there, so why should I go for vaccination? Vaccination subjects do not have to practice COVID appropriate behavior. This is the threat. Not only that, even the people who have suffered from COVID-19, there is a tendency that I have already suffered. So I have already developed the immunity. I would not be a threat to somebody else. Why should I bother to wear a mask? I'm seeing it almost every day, and they don't even bother. They go out into the community, they approach the children who are playing in the park, and it is very difficult to convince them that, look here, it does not guarantee that you will not be spreading the infection. You still have to adhere to the COVID appropriate behavior. This is where we need a mass mobilization, because these kind of rampant thing, people with education, people with authorities, people who have social influences, they also remove the mask, throw it, nothing happens, it's all right. Once you've had it, you have developed the immunity, which is not true. Vaccines are deliberate means to population control and monitoring. This is another myth which is rampant. They say that, don't believe in the media, don't believe in the quoted figures, because this is all politicized. And vaccine will definitely induce weakness and mortality. Now, this is a belief, this is a kind of so deep rooted, if I go for vaccination, I would definitely become weak. Now, this concept is so deeply rooted in Indian psyche, that, oh, you don't have the strength. Drink this, you will have the strength. Take the badam, you will have the strength. Now, strength is a very, very kind of a dicey concept in our lives of, mundane routine. And what happens? You go and find out that, yes, I'm taking this particular vitamin. Have you been advised by the doctor? No. I'm taking this drink. Kyun lete ho? No, because this will increase. And there is a belief that if you take the dry fruits more, your cognition also improves. No, it's not true. It's really not true. Unless you have the need, your nutrition is not healthy, then of course it can help you to some extent, but it's not really true. It has been researched at postgraduate level that every time, the students said that every time around the exams, my mother gives me, the cashews, the akhrot and the badam, and I take more milk and all that so that I perform well in the exam. But this is just another myth. So there is a component. If I take this, I'm not dying otherwise, but if I take the vaccine, I will definitely die. Vaccination will violate subjects' religious belief. This is another kind of a very, very dangerous thing. People get into it, politicize it, they forget that it's the human life we are talking about. And to bring it that, if this vaccine has been developed with this kind of steps, definitely we will not take it, because our religious scripture says you should not be taking this vaccine. Now, this is utter violation for the human race as such. So I think these are the things which we'll have to counter and we'll have to see. Now, these are not the only ones. I'm just adding them to what has been said before by my previous speaker. He has brilliantly highlighted all these things, and vaccines are indeed needed. One should go for the vaccination. And, there is a strategy that the selected healthcare professionals who were the frontliners, they have been shown taking the vaccines, and that mobilizes the public opinion about it. Now, strategies for mass mobilization and awakening. Now, there are certain concepts which I believe ought to work when you talk about mass mobilization. This is based on the decades of my interaction with the media, my interaction with the masses. And, when you really work at the grassroots level, you find that these are the things which really work. Select, groom, and promote role models from the community. If you have somebody who already has a stature, already has some kind of a position, already have positivity in the community, please identify that kind of a person and, groom the person and promote the person as a role model, and then go back to the community with your inputs. And I'm sure it gets accepted. Have active and supportive volunteers, informers and followers. Why do I say supportive volunteers? Okay. Informers. Why informers? Because your volunteers, when they interact, what kind of impact they have. There will be certain people who will be resisting. So your informer's job will be to come back and tell you that these are the ones who are creating problems, so that you can isolate them out and tackle them separately. Okay, and you have to have the followers also. Use audiovisual media, street play. Believe me, I've been working with Delhi police, especially for gender sensitization. I've addressed around more than 8,000 school kids. And we initiated this Nukkar Natak, a street play, and it worked really. It's very easy to give the messages through these kind of street play, folk songs, etc. And you can even have story sessions in the small gatherings where you can talk about these are the positive things. These are the certain new things which you can initiate, and it will have a definite follow-up. Create positive and sustained inflow of communication about COVID appropriate behavior and vaccination. And we might be resistant, but once we have, like the media figures, the Bollywood figures, or the religious figures, whom you follow, whom you trust, if they come and they tell you that, yes, I'm taking the vaccination, why don't you? I'm sure it will definitely increase the inflow of the positivity. Have community meetings with the vaccinated subjects. This is definitely, I can vouch for it, it will work. If you have the vaccinated subjects, I went to a small nursing home the other day, and I found they came out and they said, Dr. Datta, in our nursing home, every healthcare person has been vaccinated. That itself, sent a message to the patients who were there, and they said, once, our family members we go back to, we will see that they also go for vaccinations. When you witness that the healthcare professionals are also going ahead, and the person who has been vaccinated, nothing has happened to him, he's hale and hearty, certainly it will send a positive message. Vaccine superheroes, an aspirational social socially responsible individual who acts as a pro-vaccine spokesperson in the community. The person has taken the vaccination and is not going back to the community to spread the message. It should not happen. I think here again, the youth can be of much help to us. Simultaneously, in a country like ours, whenever you start initiating something positive, something even for the benefit of the individual and the community, there are going to be certain uproar. So you need to have martial support from the local leaders, religious figureheads, and lawmakers, and ultimately the police. All the more, I think the central message of my deliberation is that this is one virus which really can take a toll of your family, of your friends, of your relatives, and all you have to do is take the precaution, go for vaccines. Thank you. Hello.
Thank you so much, ma'am. Thank you so much. Ma'am, thank you so much for this wonderful presentation, ma'am. And you have clearly covered the strategies, the myths, the realities. You have given, being a clinical psychologist, you understand the different, the human psychiatry, so that gives us a very good, aspect to see in, because there's a lot of, idea related with behavioral change. and the behavior of a person, and especially in a country like India where we have so many myths and superstitions. So I think you've clearly given a very clear indication of what you wanted to share with the participants. And once again, we thank you, ma'am, on behalf of Vishwa Yuvak Kendra and the Science Arts and Science College, Tamil Nadu. We thank you, ma'am, for taking out time and giving in a very clear perspective through through what you have done and through your experiences, ma'am. Once again, thank you, ma'am.
Thank you. Thank you very much.
Yeah. So now we would just request, we have a lot of questions in the question answer box, and I just wanted to share as well that Dr. Dipanjan Sujit Roy has answered many questions of by questions which were asked by the participants. But sure, but we still have a lot of questions about this. So if I yes.
I'm sorry, Ajit ji, and I can see the Uday Shankar ji also. I'll have to be excused because I have to rush out somewhere. So I can take the questions later. Maybe from Ajit ji has been a big help. So thank you very much. Can I please leave with your permission? Thank you. Thank you very much.
It's great always being with you, ma'am. It's our pleasure and proud moment. Thank you so much.
My pleasure. I'm grateful to Vishwa Yuvak Kendra and of course to you. Namaste.
Thank you so much, ma'am. Thank you so much.
Thank you so much, ma'am.
Thank you. Thank you.
So we had ma'am. We just had ma'am. So we will be posting up the questions to ma'am, and maybe she will answer those questions. But surely we have some questions for Dr. Dipanjan. And so some of the questions are, this is regarding the COVID vaccine. Out of all the vaccines that are being produced around the world, how 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 does an administration choose one or two vaccines for the countries? So is there a rigorous process, or is it like made in that particular country, which is, or it can be produced by any country, sir?
Thank you, Rajat. I think this is a question which is quite aptly and appropriately asked. See, the process of developing any vaccine requires licensing. Fortunately, India is the only country in the world currently which can mass produce any vaccine. The reason being, we have Serum Institute's capability of producing 1 billion doses per day. We have, Bharat Biotech's capability of producing approximately 500,000 doses per day. We have, certain vaccine manufacturings in Biocon in Bangalore, also producing around 500,000 to a million doses per day, and in vaccine production facility of Government of India in Kasoli, which can produce up to 100,000 doses per day. Now, having said that, this is the mass productions, which means any vaccine which is going to come out in the world, which is going to be given to the developing world, will have to be produced in India. So that's the biggest advantage we have. That it's like, you can mass produce certain things. Even China doesn't have the facility to produce this. It requires rigor, control, and so on and so forth. So how do we choose it? The answer is very simple. The vaccines are always registered with WHO. There's a pre-qualification concept which goes in. All these trial notes are shared with WHO, and they oversee any vaccination part of it at different points and different times. Okay, so results are shared, but then WHO has a panel which cleared certain level of vaccines. But the country is not duty bound to take up that. The country does its own research and own analysis on the vaccine which they are going to take up. For example, in India, we have started Covishield, which is Oxford or AstraZeneca developed. AstraZeneca is a pharmaceutical company, and Oxford developed that vaccine, Oxford University. So it was done as a co-partners. The phase 3 trials were done. Then some trials were done in India too. And we accepted those figures only when the trials were done in India as per the DCGI protocol. There's a technical panels which accepts them. So it's headed by ICMR. ICMR has the Indian Council of Medical Research, heads any kind of human trials in India, the CTRI. The indigenously produced vaccine, which is Covaxin, Bharat Biotech, is the reverse. Like we developed the vaccine, we are still doing the phase 3 trials. The trial will be shared with WHO, and if any other country wants to take it, they will have to go through the same process. But for us, since we are doing the trials in India in the first place, we can easily take it as per our own protocol systems. So any choosing the vaccines is based on the best available vaccine at that point of time with the least side effects, the cost of production, the maintenance. There is also a very important thing. For example, just let me give you a simple example here. You have heard about Pfizer vaccine, which has got 95% efficacy. It's very good. But we are not going with the Pfizer vaccine because it is humanly impossible for us, or administratively, I will not say humanly impossible, my choice of words were wrong. Administratively impossible for us to maintain the cold chain at minus 70 degrees Celsius for Pfizer vaccine, which means it's of no use to us. So even if I have the best possible vaccine in the world, which can be given to XYZ, the amount of effort and energy which I'll have to spend to only maintain the cold chain will take up the complete budget of probably my whole 5 year plan for anything else. So choosing is technical, administrative, management, and the ease of administration, which is there, and acceptability. But we never compromise on one aspect, which is the safety aspect of the vaccine. So I hope I have made myself clear. Thank you.
Thank you so much, sir. I think you've put it very clearly, extremely clearly, the vaccine temperatures, the cost, other recurring costs. So, it is very clearly put, sir. Thank you for this answer. We have a question by one of the students, like in the question and answer and chat box. Is there going to be problems of black marketing in regards to the vaccine?
I do not envisage that because see, vaccine is currently being given free of cost, and government of India has made arrangements that the whole country can be vaccinated. The advantage is it's available to us at a very low cost because we didn't have to pay any royalty aspects on it, and replication of the same vaccine is done in India by Serum Institute, which the government has already budgeted for it. So should not be that much of an issue. I do not envisage it to come in the your private market shortly because it has to be controlled by the government setup for a good period of time, maybe 6 odd months. By the time I think more than three-fourths of the country would have got vaccinated. We are already going pretty good. So with that, see, black market will happen when there is the concept will be like, if you don't get the vaccine when you're wanting it, I have a little bit more money. I want to bypass the queue and all that stuff. But currently the supply is outgoing the demand, so it's okay. I don't
Okay.
envisage the black marketing to be there.
Okay. So we have one question, sir. What are the documents required for registration or to be eligible? Are there any documentation process which is required?
Yes, there are some. See, you need an Aadhaar card primarily, and any kind of identity card, not Aadhaar alone, as per the protocols, and they will be given a vaccination certificate. So normally we use Aadhaar, we can use voter card, we can use if in a village one can use even the card or assigned by the village panchayat or something if they don't have certain things. But generally speaking, in the cities where there's being given to healthcare workers, most of them have Aadhaar cards. So that's how the common process. So only one identity proof is good enough.
Okay. And so there is a question like, what is the role that we as the youth can play? One primary role that they can play starting from now, maybe not planning later, but what can they do from now, from today onwards? What can they do to be part of this COVID vaccination drive?
See, the most important is to be the source of correct knowledge. See, that is very important. See, there are lots of myths and misconception. Anything. In fact, Dr. Dutta just reiterated and gave, in fact, much better way of the human perspective from a mental health and in a psychological perspective of why people do not want to go for a vaccine. See, we may develop the best thing in the world, but doesn't need to be that it will be accepted by all. Right? There will always be people who will uh, look at you with some degree of suspicion and all that. And let's not be fooling ourselves when we say that in anything in India, when you look at, and especially in the developing world, we speak a lot of lies. It's spoken by common man, it's spoken by mid-level managers, it's spoken by government, it's spoken by everybody. So unfortunately, we do not have the accountability mechanism that we can stand. See, if you go to a developed country and others, you will never find people speaking lies at all because they can be held accountable and taken to task. Here, nobody can take you to task just because I spoke something. I can always retract back from my versions of that nature. So obviously, that causes a lot of mistrust in the common man. So here is the youth can play a superb role to build that trust and be a repository of correct knowledge and visit the correct websites, visit the correct places, and support the endeavor which is being done to help our country overcome this crisis. Thank you.
Thank you, sir. So we have a question that this India being labeled as a COVID dost or a COVID friend, around the world. What is the sort of, if I say a positive aftermath of this? What is going to be maybe in the medical world, or in terms of what will be this, what will be the change, what will be the face of this country after this? Because India is playing a very important part in COVID, in related to vaccination. So, what do you think from a perspective of a doctor that what is the world outside or the medical world outside going to think about India?
See, that's a very difficult question to answer. It is more political in nature as compared to technical in the context. As such, India's medical, as you would have all heard about something called medical tourism. It's well developed in India, the medical tourism concept. That means people from the African countries, the Middle East, Far East Asia, and others, they come to India because the treatment is far cheaper than what you get normally in places. So obviously, the concept is like this, that they have, India has simple sources, and the pharmaceutical and the drugs are very much cheaper. So a procedure which may take roughly 10 times or 20 times the amount in a neighboring country would be that much cheaper here. So obviously we had a good thing. Now with the COVID vaccination and others, see what is going to happen is, as such, you will see that India has a good vibe. That's, we have been a country of non-violence. We have been, from Mahatma Gandhi days and everything. So I think this goodwill should be extended. It will be reciprocated rather, if I may look at it. But I do not know how much in this thing, because it's all political. See, nowadays media plays a very important role for making you look like a villain, even if though you are supposed to be a hero. So it all depends on who's doing what in the media concept, and how does the others look at our concept of the COVID dose and so on and so forth. We in India may have a different perspective, but when you go across in some other countries, it may not be always taken as the similar notions or assumptions which we are taking up in that manner.
One last question that we have almost 20 to 30 questions, so we will surely, sir, you are addressing a lot, and these are the questions which are not taken up. This one last question: what percentage of the population needs to get vaccinated to have herd immunity to COVID-19?
Normally we would say a thumb rule of 70%. 70. That's the thumb rule which we take for any vaccination. It's not going to be only for COVID or something, but it's that's the context. We know that if 70% people are vaccinated and they have developed appreciable immunity, it causes the automatically the dying down of the disease or the virus, that strain which is there. So that's what we look at.
Thank you,
70%
sir.
of 1.3 billion population.
Fine. Thank you so much, sir. So the questions, as you are answering them in the inbox as well. So once again, sir, thank you so much for being there till the end, and you take out most of the time for us, and being such a person with such busy schedule, sir. And we thank you once again, sir, on behalf of Vishwa Yuvak Kendra, New Delhi, and Sons Arts and Science College, Tinnamalai. We thank you, sir. So now I would like to welcome my dear colleague, Ms. Apurva Gautam, the Program Officer, Vishwa Yuvak Kendra, to kindly give the concluding remarks.
Thank you so much, Rajat. First of all, I'm very, I would like to thank to our esteemed speakers, Dr. Dipanjan sir and Dr. Jayanti Dutta ma'am, for accepting our invitation to be part of this webinar. I would say the series we are going to do on this campaign on COVID-19 vaccination drive, sir. We are really, we feel lucky to have you as our one of our panelists to deliver your experiences and sharing your knowledge with not all of us, the team, but with the entire our young population of the institutes. So thank you very much, sir. And I would also like to thanks to our institute, Sons Arts and Science College, for being associated with us, for conducting or organizing a webinar on this need of the hour topic. Thank you so much, all the coordinating committee, coordinating members of the institute. Thank you very much, sir. So we have just discussed in detail the corona vaccine and the world's biggest vaccination campaign. A lot of things have been detailed in the presentation. A detailed discussions has happened with the esteemed speakers, and there have been good suggestions came out as well. Our speakers spoke on the efficacy rate of the vaccine and myths and misconceptions associated with both vaccines and the process of vaccination. And I would say this kind of communication and coordination between the institutions, CSOs, and activists like Dr. Dutta and Dr. Roy can play a very crucial role in the fight against such a pandemic, viruses like corona. In a way, we have presented the best example of federalism in this fight. So, which the discussion addresses the wide range of opportunities and challenges the future holds for young people. If I would be asked to conclude this whole session, the whole webinar, in this drive, what role a youth can play in this campaign, I would say that our country has already entered in this decisive phase. Here comes the need for our young generation to act as a supportive pillar. Young people are very much part of shaping the new agenda, new goals, setting up a new foundation, basically. Youth is the spring of life. It is the age of discovery and dreams. India, as a developing country, is of largest youth population in the world today. The entire world is eyeing India as a source of technical manpower. They are looking at our youth as a source of talents at low cost for their future super profits. If Indian youth make up their mind and work in close unity with working class people, I'm sure they can hold the political power in their hands. Indian youth has the power to make our country from developing nation to a developed one. From the discussion, we could now finalize, we could now think of the role of youth is of most important in current scenario. Their participation is very important because they are the country's power. Being a young brigade of a country, you have to channelize your energies in right directions. As an important role in taking ahead this global campaign, you can set a example, as Dr. Roy correctly mentioned, that you have to become a source of knowledge, source of correct set of knowledge. You can act as a volunteer. You may build a chain in replicating correct information from correct sources by acting as an organizer, in creating forums with the help of your peers and families in your community. You can take this campaign ahead with your strong forces in social movements. You can help your associated young people. You can create a chain of cadres in attaining a higher level of intellectual ability and to become a qualified adults. If we talk about in this regard of this campaign, in disseminating proper and correct information, it's time that the youth, the students have to realize their own potential, their own power, their role, duties, and responsibilities, so that you all can stand up for the whole nation, for this current global issue. Now it's time that instead of brain drain, we should act like magnets and attract world to India. India can become a developed nation only if everyone contributes to the best of his or her capacity and ability. Youth is wholly experimental, and with the full utilization of their talents, India will become a complete nation. And I would stop here by just concluding with a quotation by James Baldwin, that not everything that is faced can be changed, but nothing can be changed until it is faced. So thank you so much to again to all our speakers, to all our associated organizers, and mostly to all our participants who are listening to us, who have shown their interest and attentive ability to be with us up till now. And I'm sure you are going to replicate the same in your fraternity, in your community, in your family. So that's it from my side. Wish you a very good luck. Over to you, Rajat.
Thank you so much, Purva. Very, very well said in the end, and you gave a very good message, and about what the role of youth is in during this COVID-19. So I would just also request if Dr. G. Shashi Kumar could also switch on his video. Sir, if you can also switch on your video. So also, so Uday sir, Uday sir has been here today during the whole video, and he's the person behind this webinars, So we thank you, Uday sir, and we always love to hear you. Maybe the students will get a chance to get motivated by you in a future program, sir, and we look forward to that, sir. And thank you once again for this. Now, I hope that our students are, as we have a good number of students, more than 250 plus students are still there. It shows the dedication of the students on Zoom as well and the YouTube live as well. So I would now finally like to invite Dr. V.K. Punitawati, who is the head and assistant professor, Department of Business Administration, Sons Arts and Science College. So, ma'am, over to you, ma'am, for the vote of thanks, ma'am. Thank you so much, ma'am.
Good noon, everyone. It's my immense pleasure to propose a vote of thanks in this gracious occasion. As COVID-19, the global disaster, inverts human lives across the world, we are in the urge to aware the vaccination for our protection. This webinar clears all our myths and mistrust regarding vaccination. My sincere thanks to our respected chairman, vice chairman, secretary, treasurer, and director of our college for arranging such a useful webinar for us. I would like to express my sincere gratitude to Dr. Dipanjan Sujit Roy, who delivers his address on the importance of vaccination and its process. I extend my heartfelt thanks to Dr. Jayanti Dutta for her address about the role of CSOs for Corona Mukt Bharat, the fantastic explanation on myths about vaccination and mass mobilization strategies. My sincere gratitude to Mr. Rajat Thomas, Program Associate, and Ms. Apurva Gautam, Program Officer, and Mr. Ajit Kumar Rai, and Mr. Uday Shankar, the panelist of Vishwa Yuvak Kendra, for their greatest support for the execution for this webinar. Finally, my gratitude to the faculty members and the students of our college for their cooperation to make this webinar most useful and successful. Thank you, one and all.
Thank you so much. Thank you so much, all of you.
Mr. Rajat, I just want to share with all the participants that kindly see the links of certificates and feedback form through the chat box. We have just shared it for your convenience. Please fill your details. Thank you.
Thank you so much. Thank you so much. Thank you, Dipanjan ji. Take care.
Thank you very much.
Thank you, sir.
Thank you. Bye.
Thank you very much.
Thank you so much, sir.
Bye. Bye.
Thank
Have a
you.
great
Thank
day.
you.
Bye.
Thank you, Dr.
Bye-bye.
Sasi Kumar,
Bye.
and
Bye, Ajit ji. Bye.
Dr. Vati as well. Thank you so much. Thank you so much.